Hello there, it's Dr. Suleiman once again, Chronic Pain GP, and the next series of videos are going to be about treatment in chronic pain conditions. So, discussing treatment options is one of the most common interactions I have with patients. In today's short video, I'm going to start to discuss some of the options which are available to chronic pain patients. In particular, today's video is about self-management in chronic pain. I must emphasize from the start that there currently is no specific cure for chronic pain conditions. The best I can do as an educated clinician is to help patients to help themselves. Once patients have learned some of the skills and strategies involved with self-management, they can often lead a more productive and improved quality of life. They are often able to function more independently and more efficiently, and often their perceived pain levels can reduce. So you can often split management options into two categories. One is the non-medication based and one is medication and pharmacological based. I'm going to start which I think is probably the most important, which is non-medication based management. Effective self-care and self-management is probably the most important of the non-pharmacological treatments. As I've mentioned previously, I feel that patients are their own experts in their pain, as they have lived with pain for many years, if not decades. It's also fair to probably say that most chronic pain patients are doing an element of self-care and self-management on a day-to-day basis. This in itself can become quite exhausting and fatigue-inducing. As a result, I often see patients who are often become de-skilled in self-care and self-management strategies. So some of the key strategies of self-management are as follows. Building trusting relationships with healthcare professionals, whether general practitioners or physiotherapists, as an example. Taking medication as prescribed. Using therapies such as cognitive and behaviour therapy to help manage symptoms. I'll discuss these therapies in future videos. Modifying the home, personal and work life to instill an element of normality. Having personal values which a patient aspires to, and this goes back to previous videos on acceptance commitment theory. Being able to relax, and being able to deal with low moods as a consequence of having a chronic condition. Now, these strategies are useful for a whole host of conditions, including fibromyalgia, osteoarthritis, rheumatoid arthritis, and other autoimmune conditions. I found it's particularly useful for the management of chronic low back pain. There are many strategies available to help patients manage their long-term conditions. However, the overall arching principles are as follows. Pacing yourself to set realistic targets, and often patients can overexert themselves on days they are not feeling too bad, and often pay for this by having a couple of days of exhaustion and fatigue immediately after. Relaxation is incredibly important, particularly using techniques such as mindfulness meditation and simple breathing exercises. Nutrition and hydration are extremely important, as well as keeping the alcohol to recommended limits and reducing smoking whenever possible. Gentle muscle use is key, and certain exercises such as very gentle yoga, Pilates, swimming or dog walking are particularly helpful. Giving or allowing the patients the ability to do something they enjoy, even for a short time, is extremely useful. Small activities such as calling a friend or a family member to see how they are can boost morale and mood. Patients having a relaxing bath or shower in the evening or going for a gentle stroll can also be incredibly helpful. And one of the most important things I feel is that patients should do whatever they can to try and have a restful and regular sleep pattern. In this context, sleep hygiene is incredibly essential. So in conclusion, research has shown that effective self-management can go a long way to improving chronic pain. However, it is part of a multifaceted approach to chronic pain management. And in my experience, seeing the hundreds, if not thousands of patients, if they do not have the right skill set to self-care and self-manage effectively, patients will often struggle with their chronic pain. So if I was to be asked whether I would give self-management and self-caring strategies a thumbs up or thumbs down, my answer would be an absolute thumbs up. My next video will be about behaviour therapies in chronic pain and how they are also essential in the management of chronic pain. So just want to say once again, please remember to subscribe and sharing far and wide. Leave any feedback below, and thank you once again for your time.